A 72-year-old woman went in for a routine knee replacement surgery, and that surgery itself went perfectly. But an injection that was supposed to be used for controlling her pain was supposed to be a local anesthetic, but instead it contained a drug that is used in lethal injections. So even though the knee replacement surgery went off perfectly, she woke up and was paralyzed from the chest down. So let's get into the details. I'm a registered nurse, and I know that I have said this in other videos, but y'all, this story stopped me because of exactly where this mistake happened. Not in the operating room, but somewhere much earlier in the chain. Let me walk you through it. So Glenda Dorton is 72 years old, and she is from Centerville, Tennessee. She went into the hospital in Nashville for a knee replacement. It's a routine surgery. The problem was the medication that she received afterward that was supposed to be for pain management. It was supposed to be filled with a local anesthetic, and I will put the name here on the screen because I will chop it up. But this local anesthetic is used routinely in hospitals for procedures such as this one. But instead, according to her family, that syringe was filled with potassium chloride. So her daughter-in-law even made this statement: "The joint replacement went wonderful. Her knee is great, but the rest of her is not." And y'all, this wasn't just isolated to her. This occurred with 4 other patients in the same hospital on the same day, and 2 of them, including Glenda, were paralyzed. The family was told that the mix-up was traced back to the pharmacy. I need you to understand why this specific mix-up is so dangerous. It's not just the wrong drug, it's one of the most dangerous drugs possible. Potassium chloride is what we call a high-risk medication. In the right, tiny, controlled amounts, it's essential to how your heart's electrical system functions. In the amount and speed given in an epidural, it can stop your heart, and it can catastrophically damage the nerves around the injection site, which is likely what caused Glenda to become paralyzed. This drug, in fact, historically has been used in lethal injections. That is how dangerous a full undiluted dose of potassium chloride really is. So vials of this local anesthetic and vials of potassium chloride can look almost identical in a hospital setting. Similar size, similar caps, similar labels. Medications like potassium chloride are supposed to be locked or stored in a completely different area away from other medications, specifically for this reason. Hospitals have multiple layers specifically for preventing this kind of an error. Let me walk you through them. So first is high alert medication storage. Drugs like potassium chloride are supposed to be separately stored away from look-alike medications, locked or clearly segregated from other medications in the pharmacy. And it's because that medications like this are well-known and well-documented risk. The second layer is a label check. Before any medication is drawn up or administered, the standard is that the medication is read out loud against the order. The drug name, the drug concentration, and the expiration date every single time. The third layer is independent double checks. High-risk medications, especially ones like this one, are supposed to be double-checked by a second nurse to verify the correct medication before it is given. The fourth layer is barcode scanning. Most modern hospitals scan the patient's armband and the medications prior to administration to prevent human errors like this. For this to happen to 4 patients in the same hospital on the same day, it doesn't look like that one clinician could have made this error. It looks like a breakdown further upstream, likely at the pharmacy where things can be mislabeled or misfilled before it ever reaches the patient. That is consistent with what Glenda's family has stated. They have been clear that they do not blame the surgeon, other physicians, and the nurses involved for what happened to Glenda. This is exactly the kind of error that becomes more likely when hospitals, including the pharmacy staff, are stretched thin and overworked. This is when errors happen the most. High alert medication protocols exist because human error is inevitable. The point of this system is to catch these errors before they happen. When 4 individuals are harmed in the same day, that tells you that there was a system breakdown. It wasn't just a single nursing error. When 4 people are harmed in a single day, that tells you that an entire system, not just one person, broke down along the way. If you or a loved one are going into the hospital for surgery requiring anesthesia or an epidural, ask what medication is being administered before it is given. Don't be afraid to ask staff to confirm it out loud against the order. It's the same second pair of eyes the hospital's own safety protocols are supposed to include. Glenda Dorton went in for a routine knee replacement surgery. She came out with a permanent, life-altering injury that had nothing to do with her knee replacement. So the TBI, Tennessee Bureau of Investigation, are investigating this case. If you enjoyed this video, be sure to subscribe and hit that notification bell so that you can be notified every time I upload a new video. And don't forget to like and share. If you want to see another video just like this one, go ahead and click the video that's on your screen right now, and I will see you in the next one. Bye, y'all.